Tonight, I want you to do something unusual. Look at your ankle. Watch the skin closely. Press 2 fingers into the flesh just above your ankle, then lift them away. If the impression remains, not for a second, not for 2, but for 30, 40, even 60 seconds before your body slowly fills it back in, this is not normal aging. This is not just how things go after 60. And almost certainly, no doctor has ever explained to you exactly why this happens. Most people are told something else. Watch your salt intake. Maybe your heart is at fault. Try a water pill. Then, what happens? You spend the next 3 months running to the bathroom. Your ankles are still thick by evening. You're exhausted. And at your next appointment, the doctor shrugs and says, "Well, it's managed." Managed? As if the goal was simply to tolerate the problem. Here's the truth. Nobody told you. The reason your ankles swell has almost nothing to do with your heart, almost nothing to do with salt. Everything hinges on a system your body runs silently in the background, a system no 15-minute checkup ever explains. Stick with me, because by the end of this, you will understand your body at a level most people never reach. You will also learn a 5-minute evening habit that can change what your legs look like by tomorrow morning. Let's start with basics your biology teacher probably skipped. Most people know they have a heart. Most know about blood vessels. Arteries carry fresh blood outward. Veins bring used blood back. The heart pumps, simple enough. But here's what almost nobody knows. That system is only half the story. Your body runs a second fluid network, one that touches every single cell and carries what blood alone cannot. Cellular waste, excess proteins, debris, and most importantly for this discussion, extra water. This is your lymphatic system. And here's the single most important fact that changes everything. It has no pump. Your heart beats 100,000 times a day automatically, whether you are asleep, sick, or have been sitting for 6 hours. Your lymphatic system does not. It moves fluid one way only, through muscle contraction. Every calf squeeze while walking, every ankle flex, every time you stand from a chair, pushes fluid upward toward the neck where it re-enters the bloodstream. Stop moving, and it stops. Think of it like a bicycle pump. Nothing happens without effort. Your muscles are the handle. Every step is a pump stroke. Every hour you sit still is an hour the pump sits idle, and fluid quietly pools in your lower legs like water at the bottom of a bowl. After 60, this problem escalates. 3 things happen to the lymphatic system at once. First, the lymph vessels stiffen. Young vessels are flexible and responsive. A brisk walk gets them moving at full capacity within minutes. After 60, they lose elasticity like your skin and arteries. They respond slowly and drain less efficiently. Second, the tiny one-way valves inside the vessels begin to fail. These valves prevent fluid from flowing backward. When they weaken, fluid slides down, undoing whatever progress your muscles made. Third, the connective tissue in your lower legs, the collagen and elastic matrix holding everything together, loosens. Fluid leaks into this slack tissue and sits like water in a sponge, instead of being routed efficiently into the vessels. 3 changes, all together, fluid leaking faster, draining slower, and nowhere solid for it to go. This is the equation your ankles live in every day. Before moving on, consider this. If one leg swells quickly, with warmth and pain, this could indicate a deep vein clot. Seek medical care immediately. If both legs swell and you experience shortness of breath, especially lying flat at night, or gain weight suddenly with foamy urine, your heart or kidneys may be involved. Do not attempt a home remedy. But if your swelling is gradual, roughly equal in both legs, worse in the evening, better in the morning, and you breathe comfortably at rest, you are in the right place. Most likely, your problem is a lymphatic drainage deficit, and it responds beautifully to the right approach. Not all ankle swelling is the same. There are 3 distinct patterns that can look almost identical on the outside, but have entirely different origins. First, the venous pattern. Here, the veins returning blood from your legs to your heart struggle. Valves inside these veins have weakened or failed, causing blood to pool in the lower leg. Pressure builds inside the vessel walls, and water gets pushed into surrounding tissue. Telltale signs include ropey or knotted veins, brownish or rust-colored staining around the ankle and shin, and swelling that worsens dramatically on days spent standing for long periods. Second, the lymphatic pattern, the one we are focusing on today. This is the most common type in people over 60 without heart or kidney disease. The swelling is soft, puffy, and leaves a pit or indentation when pressed. Often it involves the top of the foot, the puffy ridge just behind where the toes meet the foot. In chronic cases, the skin thickens, almost leathery, and pinching it shows it adheres to underlying tissue. That alone tells an experienced clinician a great deal. Many people over 60 fall into this pattern. Gradual, symmetric swelling in the evening with no cardiac symptoms. And here's the reassuring news. The lymphatic system is exceptionally responsive to the right targeted physical intervention. It doesn't need a new drug. It simply needs to be reminded what it is supposed to do. Consider Margaret, age 71. An accountant for 35 years, sharp and organized, she dealt with ankle swelling for about 3 years. Both legs were symmetric, worse by evening, gone most mornings. She had already undergone a full cardiac workup, echocardiogram normal, ejection fraction 58%. Her kidneys were checked and normal. She had been on a diuretic for 14 months and had cut salt aggressively from her diet. Yet, at 8 p.m. every night, she still struggled to remove her rings. The key detail she hadn't mentioned. When her grandchildren visited one summer, she was constantly on her feet, walking to the park up and down stairs. Her ankles were better than they had been in years. When her grandchildren left, the swelling returned within 4 days. Better with sustained movement, worse with prolonged sitting. This is the lymphatic signature. This is not a critique of diuretics. For the right pattern, they are appropriate. But for lymphatic swelling, the mechanism doesn't match. What Margaret needed wasn't a prescription change. She needed a way to manually activate a system that age and inactivity had allowed to go dormant. Even people who are not sedentary, walking to the mailbox, cooking, moving during the day, can develop this problem if they sit for 4 to 6 uninterrupted hours daily. The lymph system doesn't care about total daily steps. It cares whether calf muscles contract frequently enough to keep the fluid moving. 4 hours of stillness is 4 hours of backup. There are 3 things that actively worsen lymphatic drainage in this age group. First, hidden sodium. It's easy to see the shaker on your table, but most sodium comes from bread, cottage cheese, canned vegetables, deli meats, seasoning packets, and restaurant foods. Sodium draws water from your bloodstream into tissues with chemical precision. Some estimates suggest your body may retain several cups of water for each gram of excess sodium consumed. Second, evening sitting, from 7 to 10 p.m., a time when legs need movement most, but get it least. 3 hours of inactivity allows fluid to accumulate, disrupting your overnight recovery. Third, alcohol. Even moderate consumption can increase fluid leakage from small capillaries and interfere with the hormone that reduces nighttime urine production, creating more swelling and sleep disruption. Supportive measures include proper hydration, half your body weight in fluid ounces across the day, tapering after late afternoon. Flavonoid-rich foods, like dark berries, red and purple grapes, citrus pith, and red cabbage, strengthen capillary walls and reduce leakage. Adequate protein, specifically albumin, helps retain water in blood vessels. 2 quality servings a day from eggs, fish, legumes, or Greek yogurt are simple yet highly effective tools for managing chronic lower leg swelling. Now we arrive at the heart of the solution, the 5-minute evening protocol. Everything up to this point builds toward this precise sequence. Timing and technique matter. Step 1. Morning wake-up. Before your feet touch the floor, while still lying in bed, perform 30 ankle pumps. Point your toes away, then flex them back toward your face, 30 full repetitions. This awakens the lymphatic system before gravity pulls fluid into your feet and sets the tone for the day's drainage. Step 2. The hourly reset. Every hour of sitting, set a timer if needed. Stand and do 20 heel raises, rising onto the balls of your feet and pausing at the top. If standing is difficult, remain seated and pump your toes 20 times with heels on the floor. This keeps the lymph conveyor belt moving instead of stagnating for a full hour. Step 3. Pre-dinner walk. 5 minutes before your evening meal, take a brief walk around the block or your house. Walking activates deep posterior calf muscles in a way seated exercises cannot replicate, and doing it before dinner prevents skipping it. Step 4. Evening drain sequence. 15 minutes, 90 minutes before bed. Lie near a wall or on your bed with legs elevated so heels are above hips and hips above heart. Close is fine, the goal is inversion. This uses gravity to help fluid move upward. During the first 5 minutes, perform slow ankle circles, 10 clockwise, 10 counterclockwise per foot, squeezing lymph vessels. Minutes 5 through 10, alternate slow ankle flexes. Point and flex each foot deliberately, engaging calf muscles like a pump. Minutes 10 through 15, practice deep diaphragmatic breathing. One hand on your belly, inhale slowly through the nose for a count of 4, hold 2, exhale through the mouth for 6. Each inhale compresses the thoracic duct, the central lymphatic channel, enhancing drainage. After 15 minutes, roll to your side, sit up slowly, and perform the final step. Using the flat of your fingers, stroke from your ankle upward toward your knee, 10 long strokes per leg. This is a simplified manual lymphatic drainage technique, moving fluid from saturated tissue into lymph capillaries for transport. Many notice an urge to urinate within 30 minutes, the fluid your body is clearing on your schedule. Self-assessment is key. First, the pit test. Press your thumb into the bony ridge of your shin about 4 inches above the ankle for 15 seconds. Lift it. If a visible dent remains more than 10 seconds, you have pitting edema, graded mild, moderate, or significant. Retest in 2 weeks after implementing this protocol. Second, the stemmer sign. Pinch the skin on top of your foot behind the second toe. If the skin lifts easily, lymph moves well. If flat and immovable, the tissue is saturated, indicating chronic congestion. Tonight, take 5 simple actions. Perform the pit test and note your grade. Identify one hidden sodium source to swap out. Take a 5-minute pre-dinner walk, 90 minutes before bed. Elevate legs for 15 minutes, finishing with 10 upward strokes per calf. And tomorrow morning perform 30 ankle pumps before your feet touch the floor. Continue for 14 days and retest. Your ankles are not aging badly. They are a drainage system that simply stopped receiving the signals it needs. Give it the right signals consistently, and the response is visible in the mirror, in your shoes, and in the morning when you wake refreshed without checking your legs. Finally, reflect and share. How long have you experienced this swelling? Months? Years? Longer? Has anyone ever explained the lymphatic system to you before today? If you know someone whose swelling has been misattributed to heart issues and given a water pill that doesn't fully work, share this information. It may provide the explanation no one has sat down to give them.